you're good to go now.
Okay, so lots of people I train, lots of people I treat, we talk about loosening up hip flexors. They're a tough muscle to loosen just because of where they're situated. They start on the back part of your low back and then they wrap around into the front, into your pelvis. So ART is great, muscle work is great because you can really get in there, but what can you guys do at home so that you can maintain that length of your hip flexor? A lot of core dysfunction comes from tight hip flexors, especially if you've had a baby or you sit at a desk all day. So we're going to use therapy balls. You can use a lacrosse ball, you can use a tennis ball. I like these guys. I got them from Tune Up Fitness. They kind of grab, and so I feel like they get more of that fascial release. And not just that pinpoint pressure. There's two sizes. They do different things and I use different ones on different days. We're gonna start with the smaller one. What you're gonna do is lay on your tummy and you're gonna feel for the outside of your pelvis. Once you move inside, you're gonna go past a bony prominence called your ASIS and you're gonna kind of sink into your tummy. That's where this ball is going to go, and we're gonna let gravity just kind of sink us into it. So I'm gonna find that spot, kind of open up, let that ball sink in, and I may not find the right, it may not feel right initially, so kind of move around, find that spot, and then just let your body sink. From here you can do lots of things. You guys know your body's best, so really get creative with it. I do this every morning and this is kind of my routine. I'm gonna bring my leg up, and I can feel more pressure. Bring it down. We're gonna spend 3 to 5 minutes on each hip flexor, and you're gonna really find stuff that feels best for you. From here I can go out to the side and bring it back. Out to the side. That one always feels really good. Bring it back. I can also bring my knee up, so hip extension. Just bring it up. I feel that release of that hip flexor and bring it back down. I can even go into a bit of a cobra and release some of the fascial planes superiorly. With the ball stationary, I can move my body around. So I sway my hips side to side. I can kind of inchworm up, inchworm down. That one feels good. The biggest thing is to find what feels good for you and then do this on a more consistent basis so that your hip flexor doesn't take over the full responsibility of your core.